So let us see about the carcinoma of the breast here. So the carcinoma of the breast is most commonly occurs in women actually. So we are going to see about the types based on histology. So there are 5 types based on histology. They are ductal, lobular, medullary, tubular and colloid types. So we are going to see some important points. So ductal, lobular, second one, third one is medullary, and fourth is tubular, and fifth is colloidal type. Okay, these are all the types of carcinoma of the breast. So here the most common carcinoma occurs in, most common type of carcinomas occurs in ductal. So the most common here, the most common is ductal one. Second most common here the lobular one. This is the first. Then what about the prognosis? So prognosis is all about. So first here the best prognosis which was found in tubular. This have a best prognosis. First one. And which the good prognosis is medullary one. So good prognosis. Even though the medullary carcinoma of the breast have a pleomorphisms, it shows a good prognosis. So despite of pleomorphism, it shows a good prognosis, and the worst prognosis goes to ductal one. It's slightly good prognosis. Okay, so good prognosis. Okay, this is the best one, good one, slightly good, and this is the worst prognosis. So, and this lobular ductal carcinoma, the lobular carcinoma occurs bilaterally actually. Frequently it occurs in bilateral. Another important point we have to note. Okay, this have a best prognosis due to tubules well differentiated presentations. So it have well differentiated cells, so it provides a best prognosis. Okay, what about, let us see about the histopathological examination. So histopathological examination shows, so the ductal carcinoma shows in histology a ductal structures in the histology. And here the second one, lobar. So lobar carcinoma shows Indian file-like pattern, that is Indian file-like pattern. This carcinoma occurs due to loss of E-cadherin. This carcinoma occurs due to loss of E-cadherin. So E-cadherin is a protein which helps in adhesion of the lobules between each other. So due to any mutations in the E-cadherin producing gene, it creates a loss of E-cadherin, due to which the lobules detach from each other and forms a round and oval shape and arrange themselves in Indian file-like patterns one by one. So it also called it is also called not only Indian file-like pattern, it is also called targetoid appearance. Targetoid pattern, and also called signet ring cell carcinoma. So there is signet ring cell carcinoma, and here this medullary carcinoma shows well circumferent. This one is a well circumferent and pleomorphic cells. So it also have a dense lymphocytic infiltrations in the histopathological. So well circumscribed. And have a pleomorphic cells. And shows dense lymphocytic infiltrations. this shows, and the tubular carcinoma shows, histopathological shows tubule-like structures in the histopathological examination, tubule-like structures. So these are all different types of carcinomas of the breast. So in carcinoma of the breast, we are going to see about the gene expression profiling of the breast carcinoma, which helps in the diagnosis, which helps in treatments. So and also helps in the adjuvant chemotherapy after the post surgeries. So which reduces recurrence and relapse of the carcinomas. So here we are going to see an important topic, that is about two types of cells which determines the type of carcinomas, the basal cells and the luminal cells. So first is basal cell and luminal cell. So we are going to see a few more points which is quite opposite from each other. So basal cells are actually a poorly differentiated cells. And this is well differentiated. And basal cells are a rapidly proliferating cells. These are slowly proliferating. And another important one is basal cells are chemosensitive. And opposite one is the luminal cell shows chemoresistant. And there are two types of receptors, estrogen receptors and progesterone receptors. These receptors are so much important. These basal cells shows does not, actually these basal cells does not expresses ERPR, that is estrogen receptor, and progesterone receptors, so that we are showing negative, that is doesn't expresses these type of receptors protein. So here this expresses, this is going to express this one, so we are going to see positive one. And likewise ERPR receptors, there is another receptors, there is another receptor called HER2/neu, that is HER2/neu. What does that mean? Actually HER2/neu, which means human epidermal growth factor receptor 2. This is HER2/neu. This is also an receptor. If the breast cancer shows these receptors positive, so we can able to give a drug called trastuzumab. What is trastuzumab? This is actually a prototype drug. This HER2/neu is actually a monoclonal antibody. Sorry, this is not monoclonal antibody. This drug is monoclonal antibody to the HER2/neu. We are going to see about the pathogenesis of carcinoma of the breast. So this is actually based upon that three types of receptor. We have already known that ER, PR and HER2/neu, which definitely going to help you most important things. Actually here this ER, PR and HER2/neu, but later we have to see about that important genes BRCA1, BRCA2 and P53. Here we have to just see about a pathogenesis related to HER2/neu, ER/PRs. So first of all, based on ER/PR. So if we are splitting these into two, that is ER positive, PR positive, both of them positive, and here ER negative, PR negative. Okay, these are the two. Then we are going to check for head to knee. After check for head to knee, it's again going to split into two. That is head to knee negative, ER, PR positive, because it is positive type. So ER, PR positive, head to knee negative. Likewise, head to knee positive, here negative, head positive, ER, PR positive. And here head to knee positive, ER, PR negative. Head to knee negative, ER, PR negative. Okay, these are all the types. So here, note here, this is negative, these two are also negative. We call it as triple negative. Okay. Here we have to note this first one, head to knee negative, ER, PR positive. Actually, we have to check for Ki67 index, which indicates proliferation. So after checking for Ki67 index, this again split into low and high rate of proliferations. It shows low proliferations and high rate of proliferations. So and we have already seen that ER-PR positive, which is shown by luminal types, ER-PR negative, which is shown by basal types. So here, this is also luminal, this is also luminal, this one is basal, this one is basal. So here, that based upon the Ki67 index, it splits into low and high proliferating rate. So this low is going to be luminal type A. And this high along with this is said to be called luminal type B. But this both of them are ER-PR positive, that's why we are included in luminal. And based upon this Ki67 index, we are splitting it into luminal A type and luminal B type, which include the high rate of head to knee negative and ER-PR positive, including both head to knee positive and ER-PR positive. This both of them combines to form a luminal type B. And here this is going to be, it is easy one, right? Because ER-PR negative, so this is completely basal ones. But here we are going to give a name called head to knee enriched, because this ER-PR negative, right? So we are going to say due to the positive presence of head to knee genes here, so head receptors here, head to knee enriched type, due to negative ER-PR and head to knee positive. But here you see this, all of them are negative, so this is completely a basal type. So this is actually all about the classification based on that. We are going to see the characteristics of these types actually. Now we are going to see about a few more characteristics, right? So this is luminal type A, luminal type B, head to knee enriched and basal ones. This is ER-PR triple positive, triple negative. So right, this is head to knee only positive, others are negative, right? So ER, PR, negative, this type. Other than this is heteronew positive along with or ER. This is triple positive actually. ER, PR positive. That is triple positive one. This is triple positive, this is triple negative. And this is heteronew negative. And this is ER, PR positive. Okay, let's go with the characteristic features. So let us see about the proliferation. What about the proliferation rate? So firstly, the proliferation rate, here the luminal type A shows a very slow proliferation. That is very slow proliferations. What about this? This shows a rapid proliferation. This shows very rapid proliferation. This also shows very rapid proliferations. This is all about the proliferation. Then let us see about the chemoresistance. So chemoresistance is shown by, positive ER/PR positive means it shows resistance. ER/PR negative means it shows sensitive. So here chemoresistant. Okay, that's it. Chemoresistance. Here again this is also positive, right? ER/PR positive. So chemoresistant. This shows negative. So chemosensitive. This negative. So chemosensitive. This is about chemoresistance. And it shows resistant, chemoresistant. So we cannot able to give the antibiotic based on the heteronew, like the trastuzumab. That shows a negative impact. Negative. But here this one shows plus or minus trastuzumab. Because here heteronew is negative, completely negative. So we don't have chemosensitivity at all. It is 0, nil. But here it is, even though ER/PR is positive, but it shows heteronew is also positive, right? So it shows plus or minus response to the trastuzumab. Here this is negative and heteronew is positive. So it shows positivity. That is good with the antibody. That's it. So this is about drug. And then the next point is about prognosis. What about the prognosis? The prognosis is going to be, we are going to rank according to the prognosis. First, the best prognosis goes to here. This is the one best prognosis. And the second one is goes to be this one, second prognosis, second best. And poor prognosis, this is the third one. And here going to be worst prognosis. This is a fourth prognosis. So these are all about a few important points. This is about proliferation, this is about chemosensitivity, this is about drug sensitivity. And this is related to both of them are same. And this is about prognosis. And we are going to see a little elaborated points about heteronew. That is most important. So it is actually a protein can be identified by HIC. What is HIC? Immunohistochemistry. So simple, it is a protein actually which is identified by immunohistochemistry. So this is the first thing. And based on heteronew present as heteronew in the serum, we are going to grade it according to staining patterns. So grading based on staining pattern. That is, what is the grading? 0, 1, 2 and 3. These are all the gradings. So what does the 0 and 1 indicates? 0 and 1 indicates actually heteronew negatives. This is 0 and positive. It's suppose the grading shown by 2. Suppose the grade is 2, it is mentioned to be equivocal 1. That is not sure. So in this case, we have to do a test. We have to confirm that whether it is negative or positive by taking out fish. That is, fish means fluorescent in situ hybridizations. Fluorescent in situ hybridization. So after doing the fish, we have two choices. That is, after amplification, it shows negative, means head to new negative. We have nothing to do with that. If suppose the amplification shows positive, then what's the next step? So it's at head 2 is positive. Seems to be head 2 name is positive. So next we are going to give a drug because this is positive. The drug name trastuzumab. Given. Trastuzumab is given. Okay. Then what about the grade 3? So grade 3 actually indicates head to neck positive. Simply this indicates head to neck positive. So the next step is going to be given by antibody. That is trastuzumab. That's it. I hope this makes you simple to understand the key points about the head to neck. So let us see about the inherited breast carcinomas. The inherited breast carcinomas, it is also called germ, occurs due to germline mutations. That is germline mutation. Okay, this type of, that is inherited type of breast carcinomas only occur for about 10% of all the cases, and it has two hits. One hit occur, first hit occur inherited, that is from inherited, from first hit is actually inherited, second hit is from acquired condition. Okay, let us see. Here the inherited breast carcinoma is due to mutation in three important genes actually. The first one is BRCA1, BRCA1, BRCA2 and P53. These three are most important here. These genes are actually located in chromosome 17q, chromosome 13q and chromosome 17p. This is 17 and this is 13. This, both of them are q and this is p. And we have to note here percentage. So how much percentage this? Most of 52% of the mutation occurs in BRCA1 only. So this is 52%. 52% of carcinomas, and this is 32%, and this is only about 3% of carcinomas going to occur here. So what are the other associated carcinomas going to be occur? Where all they are associated? So first, it is actually other associations includes ovary, male breast, prostate, pancreas, fallopian tube. These are other associated structures. Here, the same, these four: ovary, male breast, prostate, pancreas are going to be present again here, but the male breast more commonly in BRCA2 mutations only. So ovary, male breast that is most common here, and prostate, pancreas, and another structures here are melanoma, and gallbladder, and bile duct, then pharynx are going to occur here. It includes sarcoma, brain tumors, leukemia, and adenocortical carcinoma. So that is LAPS. It is L for leukemia, A for adenocortical carcinoma, B for brain tumors, and S for sarcoma. Let's remember why this matter. Okay. And we are going to see what about again we are going to see about receptors. So here this shows ER, PR, HER2 new. All the three are negative. That is triple negative. All the three are negative. So that it belongs to, based on PR negativity, we say that it is basal-like. Basal-like means triple negative, which includes a triple negative means basal-like, right? So basal-like, basal type. So basal type means it shows poorly differentiated. Poor differentiation. Okay, this one next. Here, ER positive, PR positive, HER2 negative. What is that? ER positive, PR positive, HER2 new. So this is ER PR positive means luminal type, HER2 new negative. So it is luminal, which shows better differentiations. Okay, and here it shows HER2 new positive. So HER2 new positive means it is ER PR negative, which indicates that this is the HER2 new enriched. That's it. This is all about the carcinoma of the breast, the pathogenesis. Okay, thank you. Support and subscribe for more videos. Thank you.